Well, great. Looking around, it looks like you have a good path around your room, no clutter, no garbage in the floor, nothing in your way. I was told in report you do pretty decent getting up on your own to the bathroom. Is that right?
Yes.
Awesome. All right. Well, do you care if I go ahead and do a quick assessment on you?
No, not at all.
Okay, great. Good. You've got a good IV working over here. I'm just going to flush it, make sure it works. Any pain with that?
No.
Okay, great. Good thing is you're not connected to an IV pole. If you were, I just ask that you use your call light right there, use that button, call me so either myself or my coworkers can assist you to the bathroom. We don't want you falling.
Okay.
Okay, great. Do you mind if I take a listen to your heart and lungs?
No, no problem.
Mr. Ron, in your own words, can you tell me why you're here?
Yeah, I was having some chest pains
Okay.
about a day and a half ago, I think.
Okay, very good.
Mm-hmm.
Well, for that reason, you're on a floor in which we will continuously monitor your heart rate, your heart rhythm, your oxygen, your blood pressure, and all of those things that can cue us into if there's any problems with your heart. As you can tell right here, we've got this cardiac monitor. It's been circulating your blood pressure. Your blood pressure looks great, 120/80. Your heart rate's in a good range.
What's normal heart rate?
We start looking at certain things with your blood pressure. I rely heavily on your doctor to let me know what your parameters are, but as a nurse, if it's over 170 or less than 90 on that top number that you see right there, then I need to notify your doctor. Also, if that bottom number is greater than 100, or if there's too much of a difference, see that little number right there that says 68?
Mm-hmm.
If that number is less than 60, I also get concerned. That lets me know that there might be something changing with your heart.
Okay.
And if the doctors find anything, I will communicate with you and let you know everything I'm doing.
Mm-hmm.
Do you know what today's date is?
Today's date is December 9th.
Okay. Do you know what time of day it is?
It's about probably about 7 in the morning.
Okay, very good. Do you know who is president?
President-elect or president?
Who
President Joe Biden, President-elect Donald J. Trump.
Well, you just answered a very important question for me. If any of your answers to my questions change between now and the next time I assess you, I also start looking for things such as strokes. With having changes with your heart, having that chest pressure, you are at risk for those things. But good thing is we continuously monitor you and prevent those things.
What do you think, or do they, what happened? What do they think happened to me?
Well, you had that procedure with your heart where they went in to look at the vessels to see if there were any blockages, or what we call ischemia. That's where parts of your heart's not getting enough blood flow. According to your chart and according to the doctor's notes, they did not find that when they did your heart catheterization. That does not mean that we don't continuously monitor you. We will be checking your vital signs often, and we look for changes.
Okay.
Great. Do you wear glasses by chance?
I do.
Okay. Do you wear them from up close, far away?
For both.
Okay. Any vision changes that you've noticed?
No, my eyes have itched a little bit.
Okay, yeah. Is that pretty normal for you?
Yeah, yeah.
Well, let me take a look at your eyes. Can you look right at my nose for me?
Mhm.
Great. Your pupils are equal, reactive to light. I don't see any clouding. They are a little red. It might be that they're itching. That's from the itchiness.
Mhm.
Okay, any problems with your breathing that you've noticed?
No, I enjoyed, you know, having my CPAP.
Very good, very good. So you've been wearing that at night.
Yes.
Great. Can you show me your teeth? Great. Can you stick out your tongue?
Uh,
Any soreness in your throat? Any
no,
soreness?
no, no, ma'am.
Okay, great. Any problems with your hearing?
No.
Great. I'm going to just take a feel right here. Any pain in here?
No,
Okay, very good. I want to take a listen to your stomach. Do you care if I do that?
that's fine.
When was the last time you had a bowel movement?
I believe it was last night before I went to bed.
Okay, very good. How often do you go at home?
Usually once in the morning and once in the evening.
Any problems with nausea, vomiting, diarrhea
You mean lately?
since you've been with us?
Oh, no.
In the past couple weeks?
No,
Okay, good.
pretty regular.
Any pain when I press down?
No.
Great. Any problems with urinating?
No, no.
Okay, great. The nurse from last night told me you've been able to get up and use the bathroom. Is that right?
Yes.
Okay, very good. I'm going to feel your pulses. Good, great pulses. We measure that, and I would call that 2+. I can feel it. Good blood supply there. Any pain in your legs?
Pain? No.
Okay, I'm gonna feel your pulses down here as well. Great pulses. Thank you for wearing your non-skid socks. Those will keep you from falling on these slippery floors. Real quick, do you care if I take a look at your skin?
No, I don't care.
Can I lift your shirt?
Certainly.
Great. We like having you come in or leave how you came in. I don't see any scars. Skin's intact. It's warm. It's dry. I plan on us keeping that way.
Okay, great.
Can I take a look at your legs for a minute?
Please.
Great. No swelling. Good. I'm going to take your socks off. I'll put them right back on. Great cap refill. That means you've got great blood flow. Can you push against my hand for me? Great. And push again like you're pushing on the gas. Great. I see some scabs on your legs. What are those from?
I was traveling recently and it was really dry.
Yeah?
And the air was dry and just kind of, honestly, it's from itching them.
Well, I will make sure I get you some lotion to keep those from itching. Your skin is the first line of defense against infection, and so I'll make sure we keep it that way.
Okay.
Are you able to sit on the side of the bed for me?
Yes.
Okay, let me get this out of your way. I'll put it right over here on your side table. Great. Can you squeeze my hands for me? Great. You've got great strength. You don't feel dizzy when you sit up, correct?
No.
I'd like to listen on your back. I'm going to listen to your lungs. Lungs sound clear and equal throughout. I don't hear any sounds that would be what we call adventitious. That's just signs of outside of a range for us nurses that would make us want to let your doctor know. Your heart sounds great. I hear regular heart sounds, no dysrhythmias. I checked your apical pulse. That's what I was checking when I was checking your heart here, and I compared it to your pulse here. Skin's intact throughout on your back as well. Any concerns or anything you want me to focus on while you're
I
here?
just feel a little anxious.
You do?
Mm-hmm.
What do you feel like is contributing to that?
Just being in the hospital and not knowing what's happening.
Yeah. I give you my guarantee as your nurse. I will keep you in the know. If the doctors tell me anything, I will let you know. I will explain anything I'm doing with you. By the way, I noticed you had a Bible. Are you comfortable with me leaving you a Bible verse on your whiteboard?
Sure.
Okay,
sure.
great. I'll put that up there before I leave.
Is it normal though to just be a little shaky, nervous?
Well, let's see. Can you put your hands out for me? Do you normally shake like this?
I've been told by people that I do. I don't notice it.
Well, I want to give you a couple of ways to help calm your nerves. Most importantly, I want to give you my guarantee. I will make every effort to keep you stable, keep you safe, and we're glad you're here on this unit. And if you'd like, at some point I can pray with you.
Oh, that'd be great.
All right, I'd love to do so. All right, well, before I leave, do you need to use the bathroom?
No, I think I'm good right now.
Okay, would you like me to get you something to drink? I do have to come back to give you your morning medications.
Yes.
Okay, what would you like to drink?
What do you have?
We have water, Pepsi products, ginger ale.
Ginger ale.
Great.
What medicines did it put me on?
So a lot of times when you're here in the hospital, we focus on two important things, prevention and maintenance. A lot of the medications they have ordered for me to give to you this morning are just that. They are going to prevent any complications with your heart, such as blood clots. They'll keep your blood pressure stable. We'll continue you on your home cholesterol medication. Our big focus is on the fact that you came in with chest discomfort. And because that scan they did with you, where they went in through your left wrist there, through your radial artery, because that came back negative for what we call ischemia or infarct, that just is fancy for parts of the heart not getting blood flow, we want to continue to monitor you and continue to investigate what caused that.
Do you know how long I'll be in here?
I don't, but here's the thing. Right now, we make sure that you continue stable with this blood pressure, heart rate, oxygen, all of those things. On my list, on my nurse assessment, I will continually communicate with the doctor, and they ultimately will decide if you are stable enough to go home or not.
Have you worked with this doctor before?
I have a great team here. I have good confidence in them. And if you have any concerns in your care, let me know.
Okay.
You have patient rights, so you have the right to know what's going on. You have the right to refuse care. You have the right to for someone to explain the whys in the house.
Okay. Any other questions? Oh, the TV. Does it get Fox News?
Yes, sir. I'll help you find that. Also, you are able to eat. So if you need help ordering your food this morning, let me know.
Okay.
I suggest a heart-healthy diet. You are not limited to what you can eat, but on a heart-healthy diet, that would entail lean meats and low fat. So low sodium, protein.
No bacon?
Well, here we do offer heart-healthy bacon.
Is that like vegetarian bacon?
No, it's regular bacon.
Okay, all right. Well, good. Well, thank you.
Well, I'm going to continue to monitor here and on your cardiac monitor, but I will also continue to circle back around.
Can you see it wherever you are?
I can.
Oh, okay.
But that's not the only way I check on you. I also come in and lay eyes on you. I will be assessing you every 4 hours and sooner if you need me to.
Okay.
And also I come in, at least me or my nurse tech will be coming in hourly to check on you.
Okay. And how about visitors?
I'm going to leave that up to you. We encourage rest, but if that helps you feel less anxious, I recommend you have people come visit with you.
Okay. All right. Well, thank you.
You're welcome.
Can I lay back down now?
You sure can. It was a pleasure working with you, Mr. Ron, and I'll see you with your medications and your drink.
Okay. Thank you.